Welcome to MedTrack 360, the first PC-based software for cancer survivors and their caretakers. In this video, we're going to start at the beginning of the software, the aptly named Getting Started portion of the software. The basis for harnessing the power of MedTrack 360 is building a foundation of all of the data about the cancer patient. Doing this groundwork not only provides the basis for all you do in MedTrack 360, but also becomes a vital database for you to share with your caretakers and your family. So let's get started. The first step is telling MedTrack 360 who you are, how to reach you, emergency contacts, and so forth. This data will be used in reports. Please note that multiple people can use this program, but the default user is the one who will use it most. So if that is the cancer patient, that is the default user. You can also list religious affiliations, blood types, etc. The basics. In the field that asks for physician, you should add your primary physician. Who's your team leader? If there was an emergency and a doctor was going to be called, who would that be? Now we move into yours and your family's health history. Why add this data? The answer is that you will be asked for this information time and time again. At every new doctor's appointment, at every hospital visit, you'll be asked for this data. It's a good place to organize it and make any notes. Please note that there are 140 conditions to choose from when you build this database, and you can add an unlimited number of new ones that fit your illness. Now we move into yours and your family's health history. Why add this data? The answer is that you will be asked for this information time and time again. At every new doctor's appointment, at every hospital visit, you'll be asked for this data. It's a good place to organize it and make any notes. Please note that there are 140 conditions to choose from when you build this database, and you can add an unlimited number of new ones that fit your illness. The 10-year wellness plan screen and supporting screens allow you and your caretakers to develop a tickler file of all the longer-term tests and follow-ups you need. This is a screen you will come back to often. For instance, if you're told to get a scan in 6 months, this is where you would log that data. The Stores and Supplier screen is another very important screen. This is where you put data about every place from which you require anything used in your cancer journey. This can include the pharmacy down the street or a special formulary pharmacy. It can also include specialized suppliers of DMEs, herbal supplements, wig sellers, specialized lingerie stores, and so on. You may have many supplies that are available only from specialized vendors. You will later tie these suppliers to the items that you get from them. You or a caretaker now have easy access to both the supplies you need and how and where to get them. Adding insurance information will also provide easy access and consolidated information for you or a caretaker to fully understand your insurance. You can add the policy numbers if you feel comfortable doing so, or just all the coverages and contact information. Understanding deductibles and co-pays may also be helpful for caretakers and family. Medical facility information comes next. Medical facilities are not only hospitals, but physicians' practices, clinics, treatment centers, dialysis centers, and so on. They are places that you go. They are associated with physicians, but they are not the same as physicians. Next, we get to your actual doctors. Who are all of the physicians on your team? Where is their office? What is their specialty? Do you want to add a map link for caretakers or drivers? How do you contact them? How do they relate to your insurance? On this and the supporting screens, you'll add all of the demographics for your physicians. Now we move on to supplies and medications. First, let's start with durable medical equipment and supplies. What non-medication supplies do you need? Catheters, walkers, IV poles, ostomy bags, diapers. There's so many things, and with them so much information is required. Do you have a hospital bed or a stair chair that you are going to rent? Where do you get these things? How much do they cost? What's the style, model, or product number? Do you need a prescription? This is information that you will need again and again for ongoing supplies, and a good history for things you have used in the past and may wish to use again. Also very good to share with your caretakers. Finally, we conclude the Getting Started portion with your medications. This screen allows you to add all of your medications and the data about them. This data will be asked of you at every appointment, hospital visit, or emergency visit. Supporting screens will allow you to log when you took and what you took every day if you wish. Note the additional data that you can keep, including possible warnings, interactions, and so forth. Note at the bottom of the screen, you can click a button to add this medication to one of 3 reports: your refills, active medications, things you're taking now, or caretakers list so they're aware of your medications. Congratulations! Now you've gotten started.